You're watching TV9 News and I'm Prajwal D'Souza. Now, in the last 24 hours, India has crossed a grim milestone. The country reported over 1 lakh fresh COVID-19 cases. Now, the resurgence of cases has brought back the attention to the basics of the COVID-19 pandemic. Yesterday, in a high-level meeting chaired by Prime Minister Narendra Modi, the centre outlined three main reasons for the current surge in COVID-19 cases. So, what are these three reasons? The first reason for the sharp rise in COVID-19 cases is attributed mainly to the failure to adhere to COVID-appropriate behavior, which includes wearing masks. Now, the second reason was attributed to the pandemic fatigue. And the third reason is regarding the effective implementation of containment measures in the field level. So, what is next? Will following these 3 pointers as suggested by the centre the next effective way to contain the surge and the second wave of COVID-19? I spoke to a public health expert and this is what he had to say.
Thank you, Doctor, for joining me on this interaction. Now, do you think the reasons mentioned in the meeting are the main cause of resurgence of the virus?
Yeah, so very clearly what is happening right now is a steep increase in cases and it seems to be happening nationwide, although there are interstate differences in the increases. It's very difficult to pinpoint saying, this is the exact reason. What many epidemiologists are saying that there is likely to be a mix of reasons, but definitely what has been reported that a laxity in complying with COVID appropriate behavior is definitely contributing to the cases. It may not explain the entire increase, but it is definitely contributing substantially to the peaking seen now.
Okay. So, Doctor, as you have observed, wearing mask and social distancing at present has gone for a toss. Not a lot of people are following these norms. So, how important is it at this time when the cases are spiraling out of control to stick to these COVID norms?
This is extremely important and it cannot be overstressed because what seems to have happened is also many people, health workers and other frontline workers have got vaccinated. So people vaccinated also often may be exhibiting complacency in following masking, distancing and in limiting travel. This also contributes to the problem. So people assume that, okay, that so many others are not masking, so why should I be doing it? I think this is very unfortunate. And secondly, also there's a lot of misconceptions about how if you are vaccinated, then you don't have to mask, you don't have to maintain distance, and you are free to travel anywhere, attending multiple functions or hosting functions in your house and things like that. This is again wrong.
Doctor, so what is the next step? Is following the 3 points the way to contain the further spread of the virus?
Vaccination has to be, that's one thing I feel, we really need to get our act together is increasing the rates of vaccination coverage. We have to expand our vaccination coverage like anything. And we have to expand the age groups, thankfully now people above 45 are eligible. We have to expand it even more. Young adults and many others need to be brought into the vaccination ambit. And there's no shortcut to this. This has to be done through carefully involving private sector, involving community health workers, involving panchayats, involving, city municipal corporations. Multiple stakeholders need to all, get together.
True. Doctor, is lockdown back on the cards due to the massive spike in cases? Do you think we might see a lockdown in the coming days?
Of course, I can only speak as a public health expert. These are decisions that are taken by, state and the national governments. Some kind of restriction, I would imagine, will begin coming back. But I hope that we don't go for the kind of, very sudden nationwide lockdowns that we did last year. Whatever has to happen now has to be much more decentralized. It has to be decentralized to specific wards. It has to be decentralized to specific cities, neighborhoods, at that level. And that's why I think we must decentralize our disease control measures as well. This
Doctor, one last question. Now, regarding vaccination, can door-to-door vaccination be organized for districts that are most affected?
Absolutely. I think it is very important. I do not know why these are not being actively considered, or maybe these are being considered and have been vetoed for reasons unknown to me. But from a public health viewpoint, expanding strategies for vaccination, increasing outreach of vaccination is vital. See, for example, remote areas where people have to travel huge distances to even go to a place where vaccination is available. Everyone is not, especially in rural areas. In those instances, we must start including, NGOs, private sector and various others, and perhaps expand the vaccination points beyond just hospitals. And this should certainly happen, potentially in large apartment complexes and various other locations.
The pandemic is still looming on us, and it is important to wear a mask, wash your hands, and maintain social distancing. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.